Hello, everyone. My name is Jeremy Kirksey.
Hi, my name is AGUAYO.
And I'm Dania RUIZ, and we are presenting on social determinants of health effects on cardiovascular health and depression. Social determinants of health affect physical and mental health that influence our overall well-being. Cardiovascular diseases are a major cause of death in the US. They are caused by various factors, including late presentation to care, fragmentation of care, and traditional and non-traditional risk factors. Cardiovascular diseases and depression are two of the most common health problems, and they share in common different social determinants that affect them, including home ownership, food insecurity, and income. Our goal is to examine the association between social determinants of health with cardiovascular diseases and depression to further understand how social issues create health inequities.
For our research design, quantitative cross-sectional survey data from NHANES from the year 2017 to 2018 was used, and the statistical analysis performed included descriptive, multivariate, and bivariate analysis. Three main categories for variables of interest were determined, the first being social determinants of health, which can be further subdivided into home ownership or housing insecurity, income, and food security. Second category being mental health, focusing specifically on depression. And lastly, the third variable being cardiovascular health. Three main hypotheses were formed, the first being participants who have ownership will report less problems with cardiovascular disease and depression. The second being participants with lower income will report greater problems with cardiovascular disease and depression. And lastly, participants with greater food security report greater problems with both cardiovascular disease and depression.
For our study's results section, we ran again a descriptive, bivariate, and multivariate analysis. In table 1, we focused on study population characteristics with our total number of participants being 5,712 people. On the left of the table, we have participant characteristics of gender, race, and age. And we also have the number of participants who fit these certain demographics with their adjoining percentages. For table 2, we have the social determinants of health for the same group. For social determinants of health on the left, a federal poverty level, home ownership, and household food security. And on the right, the numbers of percentages to match each demographic. For the bivariate analysis, we found associations between certain variables and their adjoining p-values. And what we found was association between home ownership and cardiovascular disease at p-value of 0.01, food insecurity and cardiovascular disease at a p-value of 0.03, home ownership and depression at a p-value of 0.02, and food insecurity and depression at a p-value of 0.04. There was no association found between income and cardiovascular disease or depression. For our multivariate analysis, we have our table 3 with predictors and the just R ratio of CVD and depression. Predictors looked at home ownership, federal poverty level, household food security, and perceived health. And the odds ratio are again given in adjoining percentages with the given reference groups in each category. When we ran the multivariable logistics regression analysis and adjusted for all relevant covariates, for outcome variable CVD, we found that participants with low and very low food security, and those who perceive their health as fair and poor, showed a significantly increased risk of cardiovascular disease. For the outcome variable depression, we found that those who had other housing arrangements for home ownership with marginal and very low food security and perceived their health as very good/good and fair/poor showed a significant association with an increased risk of depression.
Our study showed that participants with very low food insecurity or other housing arrangements experienced the highest rates of depression, while participants who owned a home or with very low food insecurity experienced the highest rates of cardiovascular disease. However, there was no association found between income and cardiovascular disease or depression. COVID-19 has exacerbated economic inequities in housing and food insecurity, as well as increased mental health challenges. Thus, it's critical to address these social determinant of health issues. By addressing these inequities caused by these determinants, we can better understand the overall health of underprivileged families and create better resources and policies tackling these barriers. Our research has helped close the gap in examining social determinants and their impact on both physical and mental health.